Hi everyone, I'm Brianne Scott. I'm here at Omega Project. I recently gave a talk that I wanted to share with everyone at a women's night, but keep in mind that whether you're a guy or a gal, this information can be super important to keep you healthy throughout your training period. I want to talk about how we can continue to improve our performance and our health while managing our training and our stressors outside of training. So I bring up this picture first because this is what we'd like to think we all feel like with running, happy, runner's high, never injured. And I would say in all my years of running, especially in college when I was at my best, I felt like this during training runs maybe 10% of the time. So this isn't always what happens. Oftentimes we feel more like this. And this is what I'm here to talk about. I'm here to talk about kind of the gritty parts of training and running, the injuries, the stress, the times where you just don't feel like getting up to run, or you're out there running and you feel like the vultures are circling. I don't know if that's ever happened to anyone, but I feel like it's happened to me. So I want to start by talking about some signs that you may be overtraining or be dealing with some chronic stress. And I'm not going to read through everything, take a moment to screenshot it or read through this list, but it's important to be aware of these factors here or these signs and symptoms and know that this is something that we can help to manage by managing our training and our stress. So, what is stress? Stress is actually pretty simple. Stress is our body's response to a stressful situation. And when we do respond to a stressful situation, our body produces cortisol. And cortisol is actually released by the adrenal glands, which sit right above the kidneys. Whether it's good or bad stress, you're still going to produce cortisol in response. And cortisol production is actually essential to our survival. So we do need to have this response to stress. When we are going through a training period, I think it's really important to consider causes of stress and things that might be influencing your training or your overall health. And these are some well-known causes of stress here, but we don't always consider them. I think sometimes we have some of these things going on in our lives, yet we continue to try to perform as well as we can or get frustrated when we're not able to perform as we want to. So these well-known causes of stress include work, finances, relationships. Exercise is a stress, caretaking, whether you're taking care of your kids or taking care of a sick or disabled relative, loss, transitions, and trauma. Even more important, I think, is to take note of some of these lesser known causes of stress because they are not always considered when we're not feeling good or we're not performing our best. So some of these include allergies such as seasonal allergies and sensitivities, maybe a food sensitivity, poor sleep hygiene or poor sleep in general, poor nutrition, environmental stressors, pollution, and electronic devices, our mental health and mindset. So for example, if you might be a perfectionist or you're really hard on yourself, other things like negative attitude, those can all affect our overall energy, stress, and ability to perform at our best. And then finally, we have some training errors. So when this stress builds up too much and we're trying to fit in everything, sometimes we start to feel like this. And what exactly happens when we feel like this? When we have chronic stress, we also have chronic amounts of cortisol in the system, so excessive cortisol that's in your system for a little too long. And these can lead to any of the signs and symptoms that I have listed here. Signs being things that you would test positive for, and symptoms being things that you actually feel. So, for example, a sign would be high blood pressure, or something that comes up on a blood test like inflammatory markers. And some symptoms would be difficulty sleeping, headaches, digestive issues. Hey, I'm gaining weight even though I'm exercising and eating well, and I just don't know why. So take the time to look through this and ask yourself if you've been experiencing any of these things. And unfortunately, what happens when we have cortisol in the system for too long, you can think of your adrenal glands as a battery, and the battery can run out. So eventually we get to the point where we can't even produce the cortisol that we need to respond to stress. And remember, I said that the stress response, the cortisol production, is essential to survival. So you can get yourself in a really bad spot if your adrenal glands can no longer produce cortisol. And that's when we get to this danger zone. And I don't want to scare you all. This is a really hard spot to get to. But I do want you to be aware that, yes, you can overstress yourself. I think in the culture we live in today, it's easy to want to do more, and brag about how much we're working and how much we're training and how busy our kids are. But you can get yourself to this point of adrenal fatigue, and it's not fun. I've been there for my own reasons, but some signs of this are fatigue, weight loss, hair loss, achiness, low blood pressure as opposed to high blood pressure, dizziness, anxiety, and an overwhelming feeling of not being well. I also want to talk here about this new term called RED-S. So that's relative energy deficiency in sport. This doesn't necessarily have to do with our cortisol production, but it can be a major stressor on the body. So RED-S is when there is less energy coming in than is being spent. This used to be coined or called female athlete triad syndrome, but I feel like there were common misconceptions with that. You know, you think of your young, skinny female who has an eating disorder. I think the term RED-S is more inclusive, and it can include males or females at any age. And again, basically, you're not taking in enough for what you're spending. And there's some pretty big risk factors here that include bone density loss and stress fractures, hormone imbalance, and a decrease in reproductive health, and heart disease. All right. So we've just talked about all these stressful things, and you're wondering, well, yeah, of course I feel some of that some of the time, or a lot of that a lot of the time. So now we're going to talk about how we can manage some of this stuff through training and things outside of training. And I'm going to start with training because that's what we all like to do. To start with training, I like to think of training as walking on the edge of a cliff. We're trying to do enough that we can improve, or the most we can do to improve if you're an elite, without falling over the edge of injury and sickness. So how can we manage this edge more efficiently? Actually, you'd be surprised that we can get faster by slowing down a little bit and taking more care of ourselves. So the first thing is the 80-20 rule. The 80-20 rule is basically doing 80% of your runs at a very low intensity. And if you're monitoring your heart rate, that means you would be running in zone 1 or 2 for 80% of your runs. If you're not monitoring your heart rate, We can say that you would be running at conversational pace, although I do feel like sometimes that can be a little fast. But also, I like to monitor my breathing. And I know that if I can breathe in through my nose for 5 breaths in a row, that I'm running slow enough to be in that intensity. And then the 20% is saved for the workouts that you do, and that is your zone 4 and 5. And when we do most of our runs in zone 2, the 80%, we have a lot more energy to put toward our 20%, and that's where we get faster. Now, I've coined the term zone 3 syndrome because it's something that I feel like I've suffered from a lot. After running in college, I was always just hammering out my runs, whether they were easy or not. I was always looking at my pace and things like that. So I have a really robust zone 3, and it's really hard for me to run in zone 2, but as anyone else who would start doing that type of training plan, it's good to be patient at first and really develop your zone 2. So zone 3 syndrome, I call zone 3 the satisfying but dead zone. And that's because we really don't make any more gains, physiologically speaking, than we make in zone 2. The only benefit of zone 3 is if you want to get sick or injured. So stay in zone 2 for 80% and leave yourself that extra energy and drive and mental stamina to put toward the 20%. And finally, be wary of the 7-day week. Okay, nothing magical happens on Sunday. So if you feel like you'd be better suited for a 14-day period of training where you can fit one long run and one hill workout and one interval and cycle through that way, by all means, there's nothing stopping you from doing that. And also, even when you look at, not necessarily looking at Sunday through Saturday, but looking at Wednesday through Tuesday, did you follow the 80-20 rule in that period of time? So this is my favorite example of how to utilize the 80-20 rule and to show you just how beneficial and tried and true this method of training is. So this is Eliud Kipchoge. If you don't know him, look him up. He's going for the sub 2-hour marathon, which is quite a feat. His marathon goal pace is 4:34 a mile, and the pace for his 80% is 8:30 a mile. All right, and my typical client, their marathon goal pace, for example, is 7:45 a mile. And the pace for their 80% is 7:30 to 8 minutes a mile. All right. So think about that. Is that you? Is that what you're doing? Why are you running your easy runs, your 80% faster than Eliud Kipchoge, when he obviously, has really benefited from this type of training plan? And, we always say that's probably why the Kenyans are so good, is because they spend most of their years just running really nice and easy to back and forth to school and become really efficient at that. So some other training considerations is our running economy. The running economy is the energy it takes to run. So I've listed some internal factors here as well as some external factors. So for example, we know that in most situations, men are going to be faster than women. And some of that has to do with their internal factors, such as having bigger lungs and a bigger heart, among other things, as well as their measurements and proportions. I'm here to talk mostly about the biomechanics because I'm a physical therapist, and that's what I help runners with a lot. So when I talk about biomechanics, I like to talk about the practice of running, okay? So we look at any other sport, and they don't go to practice and play the game. They go to practice and they warm up and do the drills and practice the basics. As runners, we tend to just show up and play the game. We run. So I think that it's important to question why we don't practice our running more than we do. Now, a lot of us are running in our most efficient form. We do fall into a running pattern that is efficient for us, but there are reasons that that efficient pattern might not be the best that you can do. So why should we change our form? What makes our bodies become less efficient over time? The first thing is lifestyle. A lot of us have sat in desks all day, whether it was in school or during your current job. Growth and postural changes. A lot of things can change between your childhood and teenage years into adulthood. Injuries and compensations, breathing dysfunction, pregnancy and childbirth or other abdominal surgeries and traumas, and your experience with running. So the more experienced you are, the more efficient your running pattern will be. But if you take time off running, you may have lost some of that efficiency with your running form. The biomechanics are important because they influence the amount of energy that we have moving forward and that we have going up and down. So the energy that is moving forward, instead of, for example, a braking force by landing with your foot far out in front of you, can change our performance as well as injury risk. But our injury risk is also influenced by the way that our muscles and our joints and our bones absorb energy. At Omega Project, we really like to highlight or show how important it is to be fit to run and not run to get fit. How do we make changes with our running then? So we first want to make sure that you can move. And this is basically how well you can move through a range of motion or how well you can control a motion. So that's your mobility versus stability. And strength training is actually one of the best things we can do to improve our running economy. And it's also a great anti-aging method by improving your bone health and bone density. But when we just strength train or just do flexibility, we're not always changing our movement pattern because that's something that we've had for a long time. So then we would look at your running. At Omega Project, we use a gold standard of 3D gait analysis, and we can see where we can make some changes with your running, and then we provide a slight cue to use when you run, as well as give you some drills that would help to maximize that change in your running form and hopefully decrease your risk of injury and improve your performance. So this is what our 3D gait analysis looks like. I always like to share this because it's really cool and not available wherever you go. So this is typically something a pro runner would get or someone who's at a university, but we have it here at Omega Project, and it really helps us to see where we can make the most changes with runners and keep them running. So it's really fun. But now let's look beyond the training and these things that we don't often like to consider when we're in a training period and trying to improve our performance. And these factors include but not limited to nutrition, sleep, mental health, breathing, and planning. And I'm going to touch on these, but really I could talk about them all day. So I just want to highlight some basic factors here, and if any of them speak to you, then try to take the time to look into that a little bit more, whether it's asking a healthcare provider, a physical therapist, anything like that. But the point is that training is breaking down. So whether you're lifting or doing CrossFit or running, we actually are breaking down our bodies a little bit. And that's good because then we build back up even stronger. But the building back up happens during your recovery. So the recovery is where the gains happen. So with nutrition, just some key points, again, things to consider and look into further if you think it applies to you. For women specifically, our nutritional needs are different than men. Okay, so we're not just smaller version of men. We do need different ratios of carbs and things like that. And our nutrition can also vary based on our hormonal cycles and time of life. And I have a good book I'll put in the resources here that can explain a lot of that stuff where you can reach out to me. You don't have to have disordered eating to have energy deficits, and that's really important to know. Learn about nutritional needs and common nutritional deficits before they become an issue. So, keep in mind what you might not be getting from your food, like magnesium or vitamin D, things like that. And I also encourage everyone to get routine and thorough blood work, okay? This is really important. I don't want to knock any profession or professional at all, but basically there are those healthcare providers that know more about running, okay? So that's what we do here at Omega Project. We are physical therapists who know a lot about running, whereas you can go somewhere else and they know a lot about geriatrics. Well, you need to go to someone who knows about running. So when you get your blood work and maybe things look like they're within normal limits, but for a runner, that's not necessarily the case. So I had put a reference here for those in the Wilmington area of someone that I like to see and really helps me stay healthy and stay on top of my nutritional needs and other things that might be going on. And a final point about nutrition is to be aware of your nutritional stressors. So for example, are you someone who maybe shouldn't be having gluten, dairy, anything like that could be causing your body a lot of stress without you knowing it? So seeking out the right individual to help you manage your way through that is important. And the next thing I want to talk about is sleep. I didn't really write a lot here because I feel like we all know that we just need to get enough sleep. And the reality is that a lot of us don't. And that's, I feel, is the biggest difference between an elite runner and the rest of us. Okay, so an elite runner is getting paid to run, and they're pretty much getting paid to sleep too. So they'll get up and do their workout in the morning and then go home for a snooze, get a massage, do another workout, get some more sleep, eat a ton. I think it's really important for us to consider the areas where we're not getting enough sleep. For example, are you going into a training period and you have a 6-month-old at home who doesn't sleep well? You may want to consider how your training plan could be changed a little bit, or where there's other areas of your life that you can cut back on stress and energy being spent because you're really not recovering it at night. And unfortunately, that's just the reality for some of us. We just can't get enough sleep or don't sleep well. But keep in mind that we still need to work our way around that and navigate it so we can get the best out of our training and performance. Mental health's a really important topic as well. And when I have runners, I really like to ask them these 2 important questions, or have them start to consider these 2 important questions. And when you ask yourself these questions, you really have to be honest with yourself, dig deep, go to those dark spots, because it can be greatly important for improving your health and performance. So I want you to ask yourself, am I running for my mental health, or am I running from my mental health? And do I have things outside of running that bring me joy and or help me cope with stress? All right, so take a moment to think about that. The answers to those questions are really important. And you can probably guess that if you are running from your mental health or you don't have any stress relief outside of running, that you may want to consider getting some help for that or considering how you can manage that. So I would like everyone to treat their mental health like they would any injury or illness, any physical injury or illness. Okay, so seek counseling. I think that is super important, and I don't know a lot of people who wouldn't benefit from it. They are not just there to help with what we would consider the normal mental health disorders such as anxiety and depression. They can also help with time management, goal setting, defining your purpose, and even help you develop some positive sleep habits. So take that into consideration when you start to feel like you can't manage everything between running and family and work and everything in between. So the next thing is breathing. And again, this is something I could talk about pretty much all day long, but the basics of it are that breathing is really important for our stability. So correct diaphragmatic breathing can actually help us maintain our intra-abdominal pressure. The problem is that a lot of us are chest breathing and just holding our diaphragm to help us stabilize. So we're not using it at all to breathe, we're just using it to stabilize. And this could lead to a host of problems, one of them being that you aren't stabilizing efficiently, so that can lead to injuries related to core stability, but also breathing is really important for our homeostasis or our balance, our internal balance. So correct diaphragmatic breathing helps us regulate our autonomic nervous system. So that is our rest and digest or our fight or flight. And when we have efficient diaphragmatic breathing, it improves the health of this nerve we call the vagus nerve, and it could help us manage our periods of stress by allowing us to come down more quickly from that period of stress. Here's some things that can happen when we breathe correctly. So if you're on the opposite end of these, for example, if you have high blood pressure, breathing can help reduce your blood pressure, or I should say proper breathing. Breathing correctly can also help decrease anxiety, improve your digestion, and that includes your digestion or your food intake during performance. So if you're one of those people that has trouble taking in food when you're running or performing, this is something that could help. Correct breathing can improve your sleep, improve your recovery, and also help with symptoms of exercise-induced asthma. This does not mean you shouldn't go see a medical doctor or someone who specializes in asthma when you do have asthma, but there are things you can do physically that can help with managing those symptoms. So to help with breathing, I think it's really important to go get assessed and treated by a movement specialist. Again, making sure it's someone who knows what they're doing in that area. Not everyone works with assessing breathing and improving breathing. And a movement specialist can help increase the mobility, like working on your diaphragm, just like you would massage any other muscle. The diaphragm can get tight. And then they would also teach you how to breathe and move correctly so you can continue to practice that in your everyday life. And that's where things can become a little difficult because breathing is so automatic. We don't think about breathing most of the time. It's an automatic function that keeps us alive, so it's really important. So to change our pattern, we have to think about it a lot more. So I'd encourage you, once you learn how to breathe correctly, to set a timer and check in, or check in during times where you're stressed and say, how am I breathing right now? I've actually used a tracker before called the Spire. There's a picture of it right here. I attach it on my on the waist of my pants, and it'll tell me, hey, it seems like you're tense, or hey, you haven't taken a deep breath in a while. And it makes me realize, like, even though I know how to use my diaphragm, I'm not using it very often. And finally, planning. So this is more about planning our training schedules. The first thing is to be flexible. All right, so consider when you're making a training plan what you have going on in your life. Is this going to be a period of time where you can devote your maximum to your training, or did you just have a baby and you need to back it off a little bit during this training period? And then also being flexible from week to week and day to day. So if you know you have a really busy day and work's going to be really stressful, and your kids have something at night and you want to be available for them, this might be a day where you don't do your track workout and you just do an easy run or even take the day off. If you are using a coach, pick a good coach, pick the right coach. Obviously, there's a lot of great coaches in this area and wherever you're watching from. I know there's probably a lot of great coaches, but every coach is going to have a different philosophy. And I think it's really important that you and your coach understand how to make sure you're the right fit. So your goals and your philosophy should align. If you want to be an elite or run PRs or really trying to maximize your performance, that might be a little bit different than if you want to just finish a race, or you want to get healthy through running and make sure that you're healthy for a lifetime. We can also use technology to help with some of these things. There's the one side of it where we can use it during our training to make sure we're following the 80-20. So having the heart rate monitoring is really valuable. But there's the other side of it where these watches these days, especially the newer Garmin's and something called the Whoop, have the technology to tell you how recovered you are and how ready you are. The Garmin has a body battery, so if you wake up in the morning and you're at 100%, go for it. Go for your hard run. If your body battery is at 34%, like mine was recently, maybe take the day off or take an easy run that day. And finally, listen to your body. And I'm cautious about this because I think our bodies can tell us a lot of things. I think it's probably one of our best tools, actually, but not a lot of us are very honest with ourselves or know how to really listen to our body effectively. So just be cautious with I listen to my body, I listen to what it tells me, because you have to know you're being honest with yourself and, again, answering those mental health questions and things like that. So here's some resources that I really like, especially for the female athlete. Roar has some great insight on nutrition specific for females, and then the 80-20 running by Matt Fitzgerald. Some other resources that, in my opinion, should be taken with a grain of salt, but I really enjoyed reading them and learned a lot, and they were eye-opening for learning how to really manage stress and learn how to run as slow as I need to when I'm supposed to be recovering and things like that. So take a screenshot of this and you will get a lot of information out of these resources. All right. So now we're all stressed, trying not to be stressed. And I really like to use this diagram here. These first three factors are something that I encourage everyone to write down before they set out on a training plan and check in with them often. So the first thing would be to define your values and your priorities. Okay, so if you're a professional runner and you're getting paid, your priority is probably to get yourself out the door and run even when you don't feel like it. But if your value and priority, for example, is your family, and you feel like your running has been really cutting into your energy levels or cutting into your time, and you're not going to be happy with that because you've stated that your value is your family. So this is really important to write down first. Then we want to define your why. And this isn't just like the purpose in your life or the why of your life, but I'm more talking about the why for your training, or why am I running this race? Why am I, picking this particular thing to achieve? And that could be any number of things. It could be because you want to run a PR, that changes how you train, or it could be because you want to get back into running, or you just want to finish, and that changes how you write your training plan and how you make decisions on a day-to-day basis about what you fit into your schedule. And then finally, writing goals that align with your values and priorities and align with the reason that you're training the way that you are. And the short-term and long-term goals should align as well. So for example, if you have a short-term goal of running a 3-hour marathon, but you know you will most definitely die from running that, well, that's not going to align with your long-term goal of being healthy and being able to run when you're 80. So again, check in on these often whenever you have a decision to make, and I promise that this will help you feel better about yourself when you make these decisions, so you don't feel like you're quitting or not stepping up, because we do only have so much to give every day. And while you want to constantly improve your running or get out the door and prove something, that's not always the best for your health, and this stress can add up. So this is a way to make it much less stressful and keep you happier with your running. So my final words, I wanted to quote one of my favorite authors and speakers, Brene Brown, and how she talks about courage. So the definition of courage from the original Latin word cor, meaning heart, and the original definition of courage was to tell the story of who you are with your whole heart. So I encourage you all to be courageous. Don't compare your beginning to someone else's middle. Be true to yourself and ask yourself the tough questions. And finally, trust the process. So thanks everyone for tuning in. I know that was a lot of information, and it just kind of touches on the surface of what I feel everyone needs to know to stay healthy and improve their performance. At any time, if you feel like you want to reach out to me, just go to the website and you'll find me on there, as well as Doug, who'd be happy to answer any of these questions as well. And once again, thanks for tuning in.